Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive into a really fascinating medical case. We're going to solve a puzzle where the main symptoms seem super simple, but the real problem, well, it's hiding in plain sight. Or maybe more accurately, it's actually stealing sight. So this is the big question, right? How on earth can a simple headache be the main clue that someone is slowly losing their vision? I mean, it sounds like a total paradox. One is a pain problem, the other is a sight problem. How could they possibly be connected? Let's get into it and find out.
So our story starts with a 40-year-old woman. She goes to her doctor with a complaint that, let's be honest, a lot of us have had before, headaches that are just getting worse and worse. On the surface, it seems pretty straightforward. But of course, there's a lot more going on.
But you know, what's really interesting is what she says next. It's not just, oh, my head hurts. Nope. She starts talking about these really specific, kind of weird problems. She's like, I keep bumping into doorways. I can't see cars coming from the side. And that, right there, that's the clue that blows this whole thing wide open. We're not just talking about a headache anymore. This is a full-blown neurological mystery.
So, to figure out what's really going on, doctors can't just guess based on symptoms. They need to actually see inside her head. So the very first step in cracking this case is to get a picture of the patient's brain, and for that, you need an MRI.
And there it is. So what you're looking at is a side view of her MRI scan. You really don't have to be a brain expert to spot what the doctor saw. Right there where that arrow is pointing, that's a mass. That is definitely not supposed to be there. This is our first huge piece of evidence. So what is this thing exactly? Well, it's diagnosed as a pituitary macroadenoma. Let's just break that down real quick. Pituitary tells you where it is. It's growing on the pituitary gland. Adenoma means it's a tumor, but it's a non-cancerous one. And macro, that just means it's big, in this case, larger than a centimeter.
Okay, so we found a tumor, but how in the world does that explain the headaches and bumping into doorways? Well, the answer, and this is so often true in neurology, comes down to one thing: location, location, location. This tumor is growing in a very, very crowded neighborhood inside the brain.
And this diagram just illustrates the problem perfectly. That complicated MRI we saw before, it boils down to this. You can see the pituitary gland there at the bottom, and the tumor growing right on top of it. But look what's sitting directly above it. That structure right there, that's the optic chiasm. The best way to think about it is like a supercritical highway intersection for all the nerves carrying signals from your eyes back to your brain. So the key here is that our tumor and the brain's main visual crossroads are, very unfortunately, next-door neighbors.
And with that final clue, the location, we can finally solve the puzzle. We now know enough to connect that tumor directly to the patient's really strange vision problems and give the condition its proper name.
So here's what's going on, broken down into 3 simple steps. First, that macroadenoma. It just keeps growing, right? And it starts pushing on everything around it. That's where the headaches come from, all that pressure. Second, as it grows up, it starts to literally squeeze that vital intersection, the optic chiasm. And finally, step 3, that squeezing action blocks the specific nerve signals that handle our side vision, our peripheral vision. Now, there's a fancy medical term for this, and it's bitemporal hemianopia. Let's break that down too. Bi means both eyes, temporal refers to the side vision, and hemianopia basically means half-blindness. But most of us know it by a much simpler name, tunnel vision. And that's exactly why she was bumping into doorways.
You know, a good detective doesn't just find the right suspect, they also prove why everyone else is innocent. And it's pretty much the same in neurology. We have to ask why this specific symptom and not a bunch of others. So let's quickly look at how ruling things out makes the diagnosis even stronger.
This table is a great look at how doctors think. Okay, so could this tumor cause facial drooping? Nah, that's usually a brainstem thing. Totally wrong location. What about weakness on just one side of the body? Nope, that points to the motor cortex, which is miles away from the pituitary. Imbalance? That's the cerebellum's job, back of the brain, completely different neighborhood.
And this is the fundamental rule this entire case hammers home. The brain isn't just a mushy blob. It's highly organized, super specific real estate. A problem in one tiny spot causes a very specific issue, while leaving pretty much everything else totally fine.
So let's wrap this all up. What's the main lesson we've learned from solving this really cool medical puzzle? What's the one thing you should remember from this whole explainer? It's this simple idea. A big tumor on the pituitary gland doesn't just cause random symptoms. It causes a very specific problem, tunnel vision. And it's all because of its precise location, right underneath the brain's visual crossroads. And here's why that matters. This knowledge lets doctors hear two seemingly unrelated symptoms like headaches and vision changes and know exactly where they need to look for a serious problem.
And really, it all comes down to this powerful little formula that doctors use. The pituitary gland sits in this bony little pocket at the base of the skull called the sella turcica. So if a patient has a mass in that sella area, plus they have headaches, plus they're losing their visual field, bam! Doctors can be almost certain the diagnosis is bitemporal hemianopia. It's just a perfect example of how knowing the brain's geography can solve even the most baffling cases.